I love layers. I have so many sweaters, cardigans, and jackets in my closet that I seriously get excited when the cold weather hits. And even though I have plenty of coats, I could not resist adding another one. The stretch crepe trench coat in black from Quince. This is the sort of coat I can throw on over leggings to run to the grocery store without looking like I'm in my pajamas, or pair with trousers for a chic, put together look anytime. Quince has it all. $50 Mongolian cashmere sweaters made for everyday wear, soft denim, leather accessories, and of course, coats. Lots and lots of coats. It really is the perfect place for gift giving or upgrading your own wardrobe. And since Quince works directly with ethical, top-tier factories, the prices are 50% less than similar brands. Step into the holiday season with layers made to feel good, look polished, and last from Quince. Perfect for gifting or keeping for yourself. Go to quince.com/nursemo for free shipping on your order and 365-day returns. Now available in Canada too. That's QUINCE.com/nursemo to get free shipping and 365-day returns. Quince.com/nursemo. As nurses, we both know that your shift starts before you even step foot on the unit. What you wear can really set the tone for your entire day, and that is why I love Figs. Back in nursing school, I remember those boxy, scratchy scrubs that felt like wearing a paper bag. Figs has changed everything. They make scrubs for people who actually work in healthcare. The first thing I noticed when I tried them on was how flattering they are. You know that feeling when something just fits right? Figs somehow nails it. And they're not just about looks. Fig scrubs are antimicrobial to help keep you protected, durable enough for wash after wash, and seriously, some of the most comfortable scrubs I've ever worn. With the holidays right around the corner, it's the perfect time to treat yourself or your favorite nurse to something new for the new year. Figs just dropped a bunch of limited edition colors and styles, and I already have a few on my wish list. From scrubs to accessories to footwear, Figs has a little something for every awesome human. If you want to check them out, Figs is offering 15% off your first purchase at wearfigs.com with the code FIGSRX. That's wearfigs.com, code FIGSRX. Well, hello there, I'm Nurse Mo, and welcome to Mo's Monday Minute, a shorty episode of the Straight A Nursing podcast where I share a quick tip you can start using to improve your practice or habits right away. For more in-depth topics, check out the episodes that I release on Thursdays. So in today's shorty episode, we are talking about the labs you want to look at and be aware of for your patient if they are receiving furosemide, also known as Lasix. This also applies to other loop diuretics like Bumex. I don't remember off the top of my head the brand name for that. And basically, you would probably only see Bumex used in the critical care setting, but it's basically like Lasix on steroids. It's like a very concentrated, intense form of Lasix. I want to say it's something like 40 times more potent than Lasix. So you don't really see it used all that often. So for the most part, you're looking at these things when you are taking care of a patient who is on furosemide or Lasix. So what is Lasix or furosemide? It is a loop diuretic, as I mentioned. This means that it works on the loop of Henle in the renal system, and it basically pulls off a ton of fluid. And you're going to be seeing furosemide used a lot in your patients who have heart failure and pulmonary edema. We want to keep that fluid off so that if they have pulmonary edema, we're removing it and their respiratory function is improving, or we want to prevent it from happening. So that's probably the main reason that you will see furosemide used. So 3 labs that I want you to always be looking at when your patient is on furosemide. You're looking at their creatinine, their sodium and their potassium levels. Now, would you look at other things for your patient? Of course, depending on why they are there and what is going on with them, you're going to be looking at other labs as well, but these are specific to furosemide. So first off, why do we want to look at creatinine? Creatinine is basically the lab that tells us how well the kidneys are functioning, and furosemide and other loop diuretics do a number on the kidneys, and it can cause the creatinine to increase. So if the creatinine gets above a certain point, that's going to be the point where it's like, maybe we shouldn't be using the furosemide for this patient. We may need to use a different type of diuretic. So you want to be keeping an eye on that. And if you see it creeping up, you want to make sure that you let the physician know so that they can make that informed decision whether to continue the furosemide or switch to a different type of diuretic. So number one, looking at the creatinine. Number two, we're looking at sodium. So furosemide will cause sodium levels to drop, and you want to keep an eye on that because low sodium levels, hyponatremia, especially acute hyponatremia, can be very detrimental to your patient and can cause some pretty serious neurological complications. It can even cause seizures. It can cause coma. It is not good. So you want to make sure that your patient's sodium level is A-okay so that they're not getting put at risk for this. It's not as, like the next lab we're going to talk about is more obviously affected by furosemide, but you definitely want to keep an eye on sodium as well. And then we're looking at potassium. Potassium is very, 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 very important when your patient is taking furosemide because the medication is considered potassium wasting, meaning that fluid exchange in that loop of Henle is also going to pull potassium in, and the patient's basically going to diurese fluid, sodium, and a lot of potassium. So if your patient's potassium is already low or on the lowish side, giving furosemide could push them into hypokalemia. And why do we care about hypokalemia? Because of potassium's effect on the heart. When the patient has hypokalemia, they are at risk for cardiac arrhythmias, and if it gets low enough, cardiac arrest. So you're keeping an eye on the patient's potassium. And a lot of times you'll be replacing potassium for your patient that is taking furosemide. And I would say that if your patient has a potassium deficiency, there's two ways to replace potassium. You can give it PO or you can give it IV. And if your patient has fluid volume overload, which why are they getting furosemide if they don't? But if your patient has fluid volume overload and that is an issue, giving potassium IV actually introduces quite a bit of fluid into the system. So if you can, try to give that potassium PO. It will take longer to take effect, but it's not going to bring on a bunch of excess fluid that you then have to fight with, guess what? More furosemide. So furosemide comes in giant tablets, like they're pretty darn big. Be careful with your patients who have any difficulty swallowing because they are large. And then they also do come in a liquid form, which I hear, I've never tried it. Well, why would I? I'm not going to take some of my patients' medication, but I have heard from patients that it tastes pretty darn terrible. So if you're giving them liquid furosemide, you may want to mix it with something so that it tastes a little bit better to be nice and sweet to your patient. So there you go. Those are the key labs that you're going to be checking for your patient who is taking furosemide. Creatinine to look at their renal function because furosemide can damage the kidneys. You're looking at sodium because you don't want them to have serious neurological problems with that. You're looking at potassium because of its effect on the heart. So there you have it. Next time you're taking care of a patient with furosemide, you'll know what to be watching for. See you soon. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
On a map, we can often pinpoint where pollution sources like a chemical factory or a power plant are, but it can be much harder to pin down why these things were built where they were. That is, until we turn to history and begin to understand what lay there before. In the latest season of Broken Ground, we're investigating how the legacy of slavery connects to today's environmental injustices. Produced by the Southern Environmental Law Center, Broken Ground is available wherever you get your podcasts.